Good afternoon, everyone. Thank you for joining us for another webinar on heart-healthy eating. My name is Veronica, and I'm a registered dietitian, and I'm co-presenting today with my registered dietitian colleague Fatim that I work with at the Toronto Rehab Cardiac Rehab program. We also want to give a shout out to Nilu, who's also a registered dietitian who was part of our cardiac rehab team at the Toronto Rehab, she was the one that put together the slide deck that we will be using today. So thanks to Nilu. We have ground rules. So if you watched the previous webinars, you are aware that the session is for education only. And we do invite you to ask your questions with that Q&A function at the bottom of your screen. If you click on that icon, you can always type us a question and we will be sure to answer that at the end of the session. Just to remind you though, that if you do submit a question, we can only answer the questions generally. So if you want a more specific answer for your situation, we ask that you would follow up with your registered dietitian or healthcare provider. And today we will be discussing trendy diets that you have likely heard about, intermittent fasting and the ketogenic diet. We will be discussing the pros and cons of each diet and the research to date in people living with heart disease. So there are many popular or fad diets that are marketed to individuals living with heart disease and diabetes. You as patients are exposed to so many diets from so many different sources. These sources include magazines when you're standing in line at the grocery store, the internet when you're checking your email, the newspaper when you're reading about what's happening in the world. How do you navigate which diets are fads and which show long-term benefit? Well, that's our job today, to hopefully provide some guidance about what these popular diets entail and the research behind them. Before we start, I want the audience to just think about these two questions. So the first question is, in 2019, what do you think the most popular diet was? Just take a second to think. So according to the US News, it was intermittent fasting. And in 2018, it was actually the ketogenic diet. And those are the two diets we plan to discuss today. Interestingly, according to health experts, when you ask them that question, so health experts being, researchers, diabetes or obesity practitioners, registered dietitians, when you ask them what the most popular diet in 2018 and 2019 was, it was actually voted to be the Mediterranean dietary pattern. And before that, in 2017, it was the DASH dietary pattern. So both of those patterns we have already spoken to you about in previous webinars, and we provided you with the research, the literature about the health benefits, especially for heart disease. I find that statistic, or the answers to those questions, particularly interesting because of the divide between patient and health professionals and the difference of information we both receive on diet trends and diet culture. So today, what we do is we're going to plan to go through the two popular diets. I'm going to speak to the intermittent fasting diet, and then Fatim will talk about the ketogenic diet. When we are talking about these diets, we're going to go through these three questions to assess these dietary patterns. And the questions are: 1, is it safe? 2, what's the evidence, or is there scientific literature that supports its claims? And 3, is it sustainable, or can you eat this way for life? So I'll start with the intermittent fasting. Intermittent fasting is a diet regime that cycles between brief periods of fasting with either no food or significant calorie reduction, and periods of unrestricted eating. So men and women of faith have fasted for religious reasons for centuries. During Ramadan, which is actually occurring right now, Muslims eat only before dawn or after sunset for 30 days. Christians, Jews, Buddhists, Hindus also traditionally fast on designated days of the week or calendar years. So this so-called diet has been happening for hundreds and hundreds of years. So what happens when you fast? Well, when you don't eat for a while, several things happen in your body. For example, your body initiates important cellular repair processes and changes hormone levels to make your stored body fat more accessible to be used for energy. You aren't eating food for energy, so your body has to find energy sources elsewhere. And this process of not eating can affect many organs in your body. As you can see on the screen here, it affects your brain, your liver, your intestines, your muscles. Also can impact your fat mass, which we spoke about, and your brain. Overall, intermittent fasting has been promoted for many positive benefits in the body. It can, like I said, change your body composition through loss of fat mass and weight, right? Because it's trying to use energy or find energy, and that's when your body starts to break down your fat mass to be used for energy. And it can also improve markers of health that are associated with disease, such as improving your blood pressure, your blood sugars, and cholesterol levels. And there's actually research to say that it could even improve our cognition or our brain health. And that's kind of what we've been hearing in the news and the media about this intermittent fasting. So let's dig a little deeper and see what it's all about. There are 3 different types of mainstream intermittent fasting diets. Broadly, intermittent fasting, splits up the day to include basically a time of fasting versus a time of feeding. During the time we're eating, there is no limitation to the amount of food that is consumed. And I find it quite interesting too that a lot of the research studies don't really discuss what to eat. It simply just discusses when to eat. So the most popular breakdown of intermittent fasting is something called restricted feeding, because you're restricting the time you eat, and you eat all of your calories in a specific time period. Usually a smaller portion of the day is devoted to eating. So common breakdown is 16 hours of fasting and 8 hours of feasting during a 24-hour period. It's funny because this is the most popular way of executing intermittent fasting, but there's actually the least amount of information on it. So for example, meals can be eaten from 8 a.m. to 3 p.m. with fasting during the remaining hours of the day, or more commonly, I see people skip breakfast and eat from about 10 a.m. to 6 p.m. And this type of feeding, the 16-8 is what they call it, is likely the easiest form of fasting to comply with. Another type of fasting is called whole day fasting, where 1 or 2 days per week you would consume less than 500 calories, which is about 25% of your daily caloric needs. And other days you would have no food restriction, so you could eat whatever you want. And that's the 5-2 approach, which advocates for no food restriction for 5 days of the week, cycled with less than 500 calories for the other 2 days of the week. And finally, alternate day fasting, which is self-explanatory. You would alternate days of no food restriction with days that consisted of fasting. For example, Monday, Wednesday, Friday consist of fasting, while alternate days have no food restrictions and you can eat whatever you want. Usually people eat about 125% of their energy needs on these feasting days, and then you just do this ongoing indefinitely. So those are the main types of intermittent fasting. So we'll start with the first question: is it safe? So from a patient perspective, the research cited common complaints from patients that included constipation, headaches, fatigue or tiredness, poor concentration, nausea, hunger pains, insomnia, and some dehydration. It was also noted in the research papers that dehydration could lead to hypotension, which is low blood pressure. And I also want to highlight this dehydration can be very dangerous, as it can possibly lead to stroke or heart attacks or angina. And when individuals fast or eat less calories and less carbohydrates, their blood sugar will go down. If patients try intermittent fasting and are on blood sugar lowering medications like insulin, they are at severe risk of hypoglycemia or low blood pressure. Studies showed a twofold increase of these low blood sugar events, even when patients were educated about this being a risk when they started the diet. So therefore, it may not be safe for some people if they're on specific diabetic medications. And if you are taking medications for blood sugar, you should probably consult with your doctor before starting this dietary regime to adjust your medications accordingly. And I'd also say that it'd be safe to say that you will need to increase the frequency of your blood sugar monitoring once you start this type of fasting, just to make sure that you aren't experiencing these super low blood sugars or hypoglycemic events. One more concern to note was when studies suggested patients could have inadequate intake of a protein, and some said that they could experience some vitamin and mineral deficiencies. So protein malnutrition could lead to the reduction of muscle mass, and your physical activity may suffer as a result. So I know that at the beginning I talked about it could reduce your fat mass, but in fact it could also impede your muscle mass if you're not eating enough protein during the days that you are allowed to eat. So, that being said, some of these risks could be mitigated if you do get some counseling with a registered dietitian. So things like the dehydration, protein malnutrition, vitamin and mineral deficiencies, they relate to the quality of food that people would be eating when they do eat. So, there are some people that can follow a well-balanced eating pattern to meet their nutrition needs while doing this type of dietary regime. But there's also other people who, could be making poorer choices, which don't meet their nutrition needs and could result in some of these shorter-term risks. So that's just our plug to advocate for you to meet with a registered dietitian so that you would make sure that you stay nourished. So the next question, what's the evidence? A lot of evidence is actually in animal studies. So human studies that I did see are small sample sizes. They're like 10, 20, maybe 100 people, and they're very short-term studies. So the longest study I saw was about a year. When we compare something like the Mediterranean dietary pattern that we have been discussing over the past weeks, this type, the Mediterranean dietary pattern has been studied for years and years, and that's like 15, 20 years of research that patients go through these trials for 20 years, and that's a lot of data that has been collected to say that, this type of dietary pattern is successful long-term type of way of eating, whereas this intermittent fasting, has only been studied for about a year, so we don't really know the long-term benefits. We we would like to see, more high-quality studies, including randomized control trials with follow-up greater than 1 year, in order to show us the direct effect that that intermittent fasting could provide, the benefits that have been stated, to us in the media. So there is also a limited number of studies of individuals who are living with heart conditions who partake in an intermittent fasting diet. So we don't really know the risks of individuals living with heart disease. There is a lack of evidence, and even though it's been happening for a long time with the religious population, it hasn't really been studied. So it's an emerging science, and we will be getting more evidence, but right now we just don't have it. So we need to be cautious. And sure, there is definitely some evidence that it can reduce our blood sugar, lower our LDL or lousy cholesterol, and our blood pressure. But a strong recommendation of intermittent fasting cannot be made at this time because we just don't have that research behind it. research has been done in animals, we can't necessarily assume it can work in people, and we definitely don't have enough evidence to suggest recommending this type of eating pattern in intermittent fasting over other dietary patterns that have the longer term studies, randomized control trials behind them, like the Mediterranean dietary pattern or the DASH dietary pattern. And the last question here is about sustainability. So again, when we look to research, we just don't have those long-term studies to tell us that, yes, this type of eating is sustainable or something that you could do for life. We have to think about this dietary pattern. You know, it would be very difficult for someone who likes to eat every few hours. So someone who snacks between meals or grazes, it, you know, may not be appropriate for those types of people. Also, as I suggested earlier, if you are taking medication, you know, if you're living with diabetes, sometimes when you're taking your medication, you need to be eating. And so that requires you to eat food at regular intervals. And, you know, this type of eating pattern wouldn't be appropriate for you either. That being said, you know, some people may show better compliance with this type of regime. And, you know, these people are ones who typically eat 1 or 2 meals a day and, you know, don't eat for long stretches of time, and they don't have those risks of nausea or fatigue. But again, there's not a lot of scientific evidence to say this is true. A lot of the short-term risks of protein malnutrition, vitamin mineral deficiency, hydration, and constipation can be diminished with proper nourishment. And there needs to be a focus on not only when to eat, but what you're eating when you are eating in this dietary pattern. So we do know that there is a lot of evidence about the benefits of fiber when it comes to eating whole foods like vegetables, fruits, whole grains, and as well as those plant-based proteins like the legumes and soy. So if you are missing those foods when you are eating, there is a risk that this type of eating pattern may not be heart healthy. And we also have to remember that the literature or the research has shown us that there is no right eating pattern for everybody. So, you know, if you're committed to try this way of eating, we just suggest that you speak with a dietitian to make sure you're still eating these whole foods that have shown heart healthy benefits. That's your beans and lentils, whole grains, vegetables, and fruit. So I hope that helps summarize intermittent fasting. Now I'm going to pass the presentation on to Fatim to discuss the ketogenic diet.
Okay, thanks so much, Veronica. So we're going to talk about another popular diet, the ketogenic or the keto diet. It's also been around for a long time. It was first used in the early 1900s as a treatment for epilepsy in children. Recently, however, there's been a newer version of keto that has gained popularity for weight loss and managing type 2 diabetes. So generally, when we look at a ketogenic diet, it's about 65 to 80% of calories that are coming from fat, 20 to 25% of calories coming from protein, and only about 5 to 10% of calories that come from carbohydrates. This is very different than our traditional diets, which can be 50% carbohydrate or more. So when we look at how these diets work, if we were to look at our traditional diet, our body breaks down carbohydrates like starches and sugars into glucose. As our glucose levels rise, our pancreas secretes insulin, and insulin allows glucose into our cells to be used for energy. So our body's main form of energy are these carbohydrates. Now, when we look at the keto diet, because it is so low in carbohydrates, our glucose levels fall, and our body starts to release stored triglycerides, and fatty acids travel to the liver. And then the liver produces ketones, which are used for energy instead of the glucose. Now, it's important to note, to maintain this state of ketosis, this diet has to be tracked daily. And it's not just limiting your carbohydrates, but you also have to be careful with your proteins. And you don't want to consume too much protein because this will also stimulate glucose production. So I think one of the misconceptions is that the keto diet is a high protein diet, where it's a high fat diet, but it's quite moderate to lower in protein. This is one of the reasons why medical monitoring and guidance is recommended if you are following a keto diet. However, in practice, what we see is a lot of people try this on their own. They're not being monitored, they're not testing their ketones, and so they end up not really following a true keto diet, but just following a lower carb diet. So what does a keto diet actually look like? It's a high fat, moderate protein, very low carbohydrate diet. It only allows about 20 to 50 grams of carbohydrate per day. Now, just to put that into perspective, if you were to eat a slice of bread or a piece of fruit or a glass of milk, that would give you about 15 grams of carbohydrate. So you can see it's very, very limited in the amount of carbohydrate you can go through in a day. So it includes foods like non-starchy vegetables. Those would be things like your leafy greens and vegetables like peppers and things that don't have a lot of starch. It includes all meat and deli meats. It includes poultry, eggs, fish, all types of nuts and seeds. It includes avocados and all your oils. And then with the dairy, it includes your full-fat dairy, things like full-fat cream, butter, and cheese. Now, when we look at the list of foods to exclude on the keto diet, again, it's quite extensive. So all fruit is excluded. All your starchy vegetables. So when you think of things like potatoes or sweet potatoes or squashes, those would all be eliminated. Dairy products like milk and yogurt would also be excluded. And then all your grains. So whether you think of wheat or oats or barley or rye, all your grains, your breads, your cereals would all be excluded. Legumes, like your beans, lentils, chickpeas, would also be excluded because although they do contain that healthy protein, they also contain a good amount of starch. And then all added sugars, syrups, honey would all be excluded, and any sugar-sweetened beverage would also be excluded. So you can see it is quite a restrictive diet in terms of all the different food groups that are eliminated. So let's come back to the same questions that Veronica asked. Is this diet safe? What's the evidence? And is it sustainable? So if we start looking at safety, in the short term, often the complaints with the keto diet are constipation, headaches, flu-like symptoms, bad breath, muscle cramps, and weakness. In the long term, there are increased risks for things like kidney stones, pancreatitis, bone fractures, impaired mood, and nutrient deficiencies such as vitamin D and C, calcium, magnesium, and folate. And also, since the keto diet is so low in carbohydrates, it's extremely hard to get enough fiber in the diet. And because it's eliminating things like all your grains and your fruits and your legumes, it's very challenging to meet your fiber requirements. And this not only causes the constipation, but research has shown that in the long run, this actually causes changes to healthy gut bacteria. And we know that healthy gut microbiome is essential for our overall long-term health. So when we look at people who should not try this diet, it includes people that are on certain types of blood sugar lowering medications. You have to be very careful if you're a type 1 diabetic. It's also not recommended for those people who have a history of eating disorders or disordered eating, a history of gastrointestinal issues, and those with very high cholesterol levels. And finally, when discontinuing a keto diet, you have to be very careful to avoid something called refeeding syndrome. And it has to be a very gradual reintroduction of carbohydrates. So you can't go from the 20 to 50 grams to 150 grams overnight. It has to be a very slow, gradual reintroduction of carbohydrates back into the diet. So let's take a look at the evidence. So again, like Veronica mentioned for fasting, the evidence for the keto diet is actually very short term. There are very few long-term good quality studies that exist. So if we first take a look at weight loss, we know that the keto diet does produce greater weight loss than other diets in the initial stages. So that's usually between the 3 to 6 month mark. However, the research shows that after that, weight loss actually slows down. And at the 12-month mark, most studies comparing the keto diet to lower fat diets show absolutely no difference in weight change. As I mentioned, currently there are no long-term studies that actually look beyond 2 years. So there are no real measures of long-term weight loss success in humans out there. And one of the reasons is that because this is such a hard diet to maintain long-term, there's a lot of dropout in these research studies. And in fact, even some of the 12-month studies had about a 40 to 60% dropout rate from participants because they just couldn't follow this longer than that. So then if we look at cardiovascular health, there is very little support for the keto diet. These diets can moderately improve your HDL or your good cholesterol and lower your triglyceride levels, but they can also increase some types of LDL or lousy cholesterol. They don't show any difference in blood pressure management. And again, we don't have any long-term studies that look at the effect of a ketogenic diet on cardiovascular disease outcomes. And then lastly, if we look at type 2 diabetes, there is some evidence that the keto diet may benefit the management of blood sugars in the short term if it's delivered in a safe, clinically supervised manner. And in fact, Diabetes Canada just came out with a position statement on the keto diet this week. However, it's important to note that the evidence is still very limited to short-term studies, and each individual will need to consult with their healthcare provider to assess the risk versus the benefits of this diet and look at the sustainability with their own individual lifestyle and food preferences. And then lastly, is this sustainable? So as I mentioned, even in the research, there was a high dropout rate because the diet is very, very restrictive and strict monitoring is needed. The keto diet's also very challenging to follow in social situations, and when you're traveling, you might not have as many choices when you're eating out. And then the long-term impact of avoiding entire food groups, like avoiding all breads or avoiding all fruits, is very, very hard for most people. And then lastly, we need to also think about the environmental impact. So what are we doing to our environment when we're eating a more animal-based diet rather than a more plant-based diet? I think at the end of the day, you have to look at your own individual circumstances. Is this a diet that you can sustain for life? Are you able to get enough support to make sure that you're getting the adequate nutrients and monitoring? Is a restrictive diet going to lead to disordered eating and weight cycling, or that yo-yo dieting that can have a negative impact on your overall health? And lastly, are there any other dietary patterns out there that may produce the same outcomes with less adverse effects? As Veronica mentioned, maybe following a Mediterranean diet or a vegetarian diet, or following the healthy plate method from the food guide might be a more sustainable diet for you. There is no one size fits all when it comes to healthy eating. A good diet is one that nourishes you and keeps you healthy, but also one that is enjoyable and sustainable. So lots of things to think about before you choose a diet that's going to work for you. So I think that's a quick overview of the keto diet and the intermittent fasting. We'll open it up to some questions now.
Great. So thanks, Fatim. There are two questions, and they're both about intermittent fasting. So the first question was, I'll read it here. I think the question of safety of intermittent fasting was answered very generally. While there are differences between the three types of intermittent fasting models, actually the 16-8 fasting model has been recommended by doctors in Germany, and it has been showing much benefit in patients with various diseases from obesity to arthritis to tinnitus and more. So thank you very much for submitting that comment and question. I agree, the intermittent fasting answer that I provided about safety is general, but that's because the evidence or the research that we have right now isn't enough to have a strong recommendation that, you know, it is safe, and it is safe for people living with heart disease. So right now, there hasn't been any directive, you know, from the American Heart Association that this is something that we would recommend for individuals living with heart disease. And that's not to say that in the future that they won't be recommending it. It's just that right now, the evidence that we have, we just can't strongly recommend it. If you are interested in doing something like the intermittent fasting, I just do encourage you to meet up with your registered dietitian, as well as consult with your doctor, just to make sure that it is safe with you, or safe for you, and your medications that you're on, and your history, your health history. Hard to generalize right now, so just to make sure you're safe. And then this other question, how does intermittent dieting work with diabetes and cardio issues? So the intermittent fasting, as I said, there is not a lot of research, if any, about intermittent fasting, specifically in individuals living with heart disease. So we can't speak to that, whereas there is some research about intermittent fasting while living with diabetes. And a lot of it has to do with the fact that it can lower our blood sugar, and that we do have to be safe when participating in this dietary regime while on the blood sugar lowering medications. So again, if you are on any of these blood sugar lowering medications and want to try this type of eating pattern, I do recommend consulting with your doctor to see if your medications need to be adjusted before going on this type of eating pattern, because we do know that it will reduce your blood sugar. But to the question about the cardiac or cardio issues with intermittent fasting, we don't know a lot of, we don't have the research there yet, but hopefully soon.
Great. I don't see any more questions. If you still have questions, you're welcome to type them into the Q&A box. But I'd just like to emphasize what Veronica said, that, you know, if you are thinking of trying any dietary pattern and you're not sure if it's right for you, it's always a good idea maybe to consult with a dietitian or your doctor, just to weigh out the pros and cons, go through your medications and how they might impact the foods that you're eating, and go from there. But I think the big thing is the sustainability as well. So you have to really find something that you can do for the long run. This isn't something that you would be doing just for a few months or a year. It's trying to find a pattern of eating that works for you for life.
So I don't see any other questions coming in, so I guess we can end it there. I will just flip to the next screen, which is talking about tomorrow's session. It's a topic about exercising in hot weather, and as we know, the sun's shining today, and the weather is just going to get warmer this week, which is lovely. So Renee will be talking about this tomorrow. And then next Tuesday, there will be a topic about the history of breast cancer. So that is for the Women with Heart online series. So if you're interested in those topics, please tune in for those. And I think that's it for today. If you have time to get outside today, enjoy the sun and enjoy the sunshine. But if you do, be safe when you go out. Great. Thanks so much. Thanks for attending, and thanks for the questions.
Thanks, everyone.